Will is a very special child. He's always enjoyed playing the game of baseball. Before this accident, he was out on the field every single day for 4 months straight, every day, and loving every minute of it.
On December 9th, I think, I was hit in the head by a baseball. And when I was hit, I remember trying to get up and I felt my head. But then once I got up, I was staggering a little bit, then I fell down and I passed out for a couple of days.
And so my phone starts ringing, and it was my other son, Will's twin, Nick. And Nick says, "Mom, you've got to get down to the field quick. Will's been hurt. The paramedics are here. The medevac is coming." It was one of the scariest moments of my life. That's a lot for a mom to see.
He got hit in basically the eye with a baseball, and he ruptured one of the main arteries that feeds the brain, called the carotid artery, right at the skull base. He had a large bleed at the base of his brain, and then he went through a series of tests to study the anatomy of exactly what type of problem he had. It showed that the tear in the artery had developed into what's known as a pseudoaneurysm. A very dangerous situation for a patient to be in because the blood vessel's very thin, and if it were to rupture again, he would almost certainly die.
It was one of the scariest moments of my life. I knew he was in good hands, but I knew that this was going to be major.
Cerebrovascular surgery is one of the more difficult, if not the most difficult, piece of neurosurgery. And the stakes are high here, and there are a million ways for things to go wrong in the operating room. So I last saw William. As far as I could tell, you wouldn't be able to tell him from any other kid his age. But as far as the rest of his life goes, he is, as normal as any other kid is.
Life for Will now is much the same as it was before surgery. We're very, very thankful for that. He's back to pretty much everything that he did before. Contact sports are probably out for him forever, or until, he feels comfortable taking responsibility of that on his own.
It was actually 3 weeks I was in hospital, but it was absolutely great because doctors were with me and nurses were with me almost 24/7. Levine's was great.
The care in the hospital was wonderful. We came to love the nursing staff there. They were just like our family. Will has a clean bill of health now. We have to go back and see Dr. Waite every 6 months to a year. Other than that, Will is Will, and we're thankful.
About 4 weeks after the incident, I went to the baseball field where they were having practice, and my coach, he gave me the chance to be the honorary team captain. So I was actually the honorary team captain for the JV and varsity this year. It was a great feeling.